A few members of our board are dabbling with AI as clinical physicians. So let me just say they dabble. And that's exactly where I would put AI, artificial intelligence, right now in the healthcare space, as many are dabbling.
Welcome to the Business of Healthcare podcast. From the Center for Healthcare Leadership and Management at the University of Texas at Dallas, Naveen Jindal School of Management. Here at UT Dallas, we bring together business heads and other thought leaders to help navigate the challenges of our rapidly changing, increasingly complex healthcare ecosystem. I'm your host, Professor Dan Karnuta, Director of the UT Dallas Professional Program in Healthcare Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any future episodes. You can also join us online at businessofhealthcarepodcast.com. In this episode, we're going to continue to dive into the multifaceted topic of artificial intelligence in healthcare, but this time not from a provider or payer or pharma standpoint, but from an industry-wide AI standard-setting view. AI could be used in healthcare in as many ways as one can imagine. And frankly, that has many of us concerned about issues like patient privacy, logarithmic care delivery decision-making, and much more. So that quickly leads us to the question of how AI will be controlled and monitored in healthcare. Well, we're fortunate for this episode to have Donald Taylor with us. Don is a professor at UT Dallas and UT Southwestern, and he's also the director of the Alliance for Physician Leadership at UT Dallas. And importantly for today's topic, Don is the chairman of the Healthcare Standards Institute Board, which is responsible for developing a national standard for AI governance in healthcare. Don, welcome to the podcast.
Great. Glad to be here and eager to share some thoughts.
Well, before we get into the AI standard setting process, Don, what is the Alliance for Physician Leadership?
Well, hey, thanks for that question and the opportunity to share a little bit about kind of what I do on a daily basis. So my day job is the director of the program. We are a very unique physician leadership program, as I term it sometimes with docs who apply, is we're a leadership development program that happens to give an MBA on the side. And they sort of relate to that because not only do we take them through the curriculum of developing and acquiring an MBA, an MS, or sometimes both, we also develop them as individual physicians in a very turbulent, a very noisy healthcare space that has become ever more divided in not only how it functions, but the gaps between their purpose, patient care, and the business elements of healthcare. And that, by the way, is a complete different discussion, so I don't want to go too far there. But we're a great program that's been around 24 years, founded by Dr. John McCracken. We have alumni, about 600 from across the country. We're one of the top 4 in the nation for executive education for physicians. Ironically, we don't advertise. It's mostly referrals. And if you apply now, you would probably start a residential program within 12 to 16 months, which is a great problem, but we welcome them all. We just finished a class actually on HIMT this last weekend. So I have some fresh ideas to share as we talk about the role AI and the role informatics may play in the future of healthcare.
Well, you're also the chairman of the Healthcare Standards Institute Board. How did you come to have that position?
Well, sometimes it's just time served and you just get recognized. However, the Healthcare Institute's foundation and the Healthcare Institute itself are two separate entities owned and founded by Dr. Veronica Muskies-Edwards, who I've happened to have known for a few years. In the early days, we met actually during COVID when I worked with her on one of the, what I call indigent processing sites for undocumented boys here in Dallas, and I helped her build a healthcare infrastructure around that in her parent company in Genesis, which is a staffing company that she is CEO of. So through the standards, she many years ago saw a gap of need in standardization of healthcare management. We had seen it arising through clinical standards and through the professional silos and or let me just say cylinders of excellence amongst not only the nursing community, the ancillary community, but the physician specialty community. but she saw a gap in the management side of healthcare that wasn't entirely being fulfilled by the Joint Commission, which is primarily focused on the inpatient setting. So there was this other area that was needed. So she began to envision this Healthcare Standards Institute and its needs. And I became involved with that early on with her in developing the vision. So it's structured in a couple of ways. One, in the foundation is to develop the standards as a nonprofit 501c3 organization, and the board oversees that. And now I recently was selected as chairman of the board, of which we have committee members from across the nation, experts across the field and representing various health systems across the nation are members of the board. That has been occurring now for about 2 years, maybe 3. And now we're beginning to develop unique standards of need across the system. This actually is built to facilitate innovation, education, and progress in just the organizational management of healthcare systems. So we think the Standards Institute is, first of all, timely, but appropriate to fill that gap of standardization across, frankly, diverse things in U.S. healthcare, and I will say international healthcare as well, because we oversee and have been approved to be a developer for ANSI standards.
What is ANSI?
The American National Standards Institute, which develops standards for the U.S. And then there's an also international standards organization, ISO, for developing them outside the U.S. So these are sanctioned entities that grant you the authority and the permission to develop and acquire and oversee a standard, not only in its development, but also in awarding of the standards as well. So we're in the infancy of that, with a few standards under our belt, with a few that we have, frankly, on the plate to develop in the future.
So what types of standards has the foundation already created?
We've developed those in patient-centeredness has already been one that's developed. There's recently been one in quality. We're near the end of developing management standards for telehealth. And we also are about to publish one on blockchain and physician credentialing so that you could, for instance, have a standard platform and share credentialing of physicians across the nation rather than having to do it uniquely with verified credentials. And you could audit and track this.
What is ANSI? How does ANSI get its power?
Well, ANSI has been granted authority and accepted as an authority of overseeing standards throughout industries across the nation. It had been established for a while and granted that authority by the government. We are in the early stages of healthcare management standards within ANSI because historically, the only entity offering standards have been the Joint Commission in operational processes. There's a few others that develop them for ancillary facilities or unique niches in laboratories and some others. But for the management side, that had been primarily overlooked or not embraced. We think there's a massive opportunity not only in healthcare standards, but also in healthcare operations, where using the power and frankly, the brand recognition of ANSI for HSI to enter into that space and develop these standards for, again, a number of benefits across why standards should be helpful. And we could talk about that in just a moment.
Well, so how does just in really simple terms, how does a U.S. healthcare standard get born, if you will, and then get approved by ANSI?
It takes a while. There's time, but generally it's pretty simple in that if you we're fortunate that our board is comprised of, frankly, eyes and ears and expert observers who recognize gaps right now in healthcare. So those that like credentialing with blockchain, that was a need. Telehealth was born during the end of COVID, and telehealth was thrown into the industry and these aren't clinical standards. Please understand, clinical standards are pretty well developed. Now, again, there's many of those. But for management standards, how do we work telehealth? How is it offered? We look at those, and so our board of experts actually provide ideas and reviews of things that say, we've suffered for that. We're working right now, we're just developing one on the potential for air quality, because that was a gap inside our COVID response. And so what is the air quality? Well, we do it for clinical standards through some subsets of that, but we do that for the waiting rooms? Do we have such standards for examination spaces and for public spaces? What is the overall air quality standard for healthcare? So we're in the midst of developing that, looking across the nation of existing standards and seeing if there's a need for another overarching standard to protect the management and then kind of plug it into the management side of healthcare.
So do you run these ideas that germinate through your board members and others? Do you float these to ANSI beforehand?
We develop early on an outline, which is a project initiation notification. And so HSI has been pre-approved as a standard developer by ANSI.
That's the Healthcare Standards Institute Foundation, which you are the chairman of the board of the.
Right. And so we've been pre-approved to develop standards, which takes, not only a certain amount of diligence and governance and oversight and responsibility in disclosure, but also auditing. And we just successfully finished the audit through ANSI to continue this and to enhance the standards that we can offer. So audited entities first and required. So we then look at cross and go, now what can we develop and how is that done? Our board members are kind of eyes and ears, but we certainly take outside members. You don't have to be a board member. Anybody can bring an idea to us. And then for the period of time, you could become deeply involved in the development of this standard if something you care about. So for instance, when you do develop the standard, the first thing you do is develop the pen, which is essentially a short outlining of an idea of the standard and the elements of the standard. Like for instance, the one we're going to talk about in AI was about a page and a half. That was all it was at the beginning, just to outline. From there, you develop that with a preliminary committee, not the formal committee, but a preliminary committee that's maybe part of the board membership, but it also could be people outside of that under the oversight of HSI just to make sure we're in compliance. Once we develop kind of an outline of this proposed standard, HSI then submits it for public comment through ANSI. Like, for instance, the AI standard published in July and was available for public comment through September on the ANSI website, which is ansi.org. And you can find them there. From there, we wait for people to comment. And if they comment, great. Then we answer those. Then ANSI grants us permission to go further and develop the standard.
I see. Yeah. So once before we'll get into AI here, dive into it in a second. But
sure.
I just want to set the stage for the standard setting. So a standard is developed and approved by ANSI, and it becomes a blessed standard, if you will. Why would a healthcare organization follow an ANSI approved standard? Is there some sort of legal teeth to it, or is it, again, why would I follow that if I'm the CEO of a payer or a provider? What's causing me to say, oh my gosh, an ANSI standard's been set down from on high, I better follow it?
Well, first of all, you go, is the standard relevant and appropriate for my organization? That's the first thing you would see. So I would look at these and actually we'll go into a little later. That's how the AI standard came about, or the one we're working on for governance. Is I would be, if I'm going to put my CEO hat back on for a moment and go, what is it my organization needs to compete effectively in this market? Not only locally, comply with expectations of the state, and by the way, perform better within a national scale. And by the way, am I making money, or is there ways to make money? So ANSI standards create opportunities for you to improve efficiencies, and it gives you a great sort of permission to embrace the standard and then improve efficiency in your operation, which maybe streamline certain processes. It also says I function within an accepted standard nationally, which gives you a little bit of leeway and legal protection under certain things. The next one is improved quality of care, just to prove you're in compliance with regulatory guidance. Standards bring discipline back into your organization as well. The other part is particularly patient safety, even interoperability. All of a sudden, you would say, I'm in with the standard and I'm working. My competitors and or my partners, if they follow the same standard, we have some congruency for interoperability and sharing of information. And by the way, also shared processes for staff that work these nationally. The other is recognition, marketing differentiation. because sometimes you want to be, for instance, a great example is the ISO 9000 standard for quality, which is well known everywhere. Well, that's a differentiator of process. If someone has a label certified ISO 9000, they know you're an efficient organization that's met certain standards of performance. The ANSI standards do the same for domestic. The other part, too, is like the Joint Commission, you can't take Medicare reimbursement unless you're accredited by the Joint Commission. So sometimes the federal government can use these standards to put teeth inside their processes, rather than because the federal government can't direct healthcare, they can direct payment. So they can use the tool of payment to move you to compliance with standards.
Right. So CMS, which is the Center for Medicaid and Medicare Services, they could jump on the back of a standard and say, hey, if you're not certified with this standard, then you're not getting reimbursed for you can't treat Medicare patients.
And that's the way they sort of indirectly influence policies, standards, procedures, and healthcare operations through the control of the payment mechanism.
Right. I would think this AI standard we're going to talk about now would be one of those standards that, would probably get a lot of teeth in it through government acceptance.
I think so. And we can talk about that again in a moment because I think it will. But there's other things too. Mitigation of risk. If you have an exposure and you're doing your own thing and you have a bad outcome, well, your risk is somewhat mitigated if you complied and can document your compliance and adherence to a standard, whatever it is. So, for instance, if I have a standard on the way I do revenue cycle or bill collections, if I'm adhering to a standard, I'm less legally liable or exposed. So standards have become almost a safety net of protection in mitigating your risk. The other part, and the last part of this, is that it builds trust and it also enhances reputation in the marketplace. But above that, it also protects your board. Board members need to assure standards are implemented and followed to protect the board itself, to protect the overall mission of the organization.
Okay, so let's get into AI specifically then. What is your board's role in setting a standard for AI in healthcare?
But let me start back with the idea. So this was a few months ago. A few members of our board are dabbling with AI as clinical physicians. So let me just say they dabble. And that's exactly where I would put AI, artificial intelligence, right now in the healthcare space, as many are dabbling. I look at it from a different perspective. I'm always looking at it from the operational, organizational, more of a strategic level. It's just my background. And from my own operations, not only of large hospitals, but also large health systems. From the federal and state side. And I'm looking at this going, you're playing with it. Doc's playing with it. They're using it. I know they're asking various artificial intelligence bots and models to provide either clinical information, to advise them, or to even communicate with patients in a certain way. I know that's happening. I know there's certain industries using it, insurance is using it, in claims management, claims denial. That becomes dangerous, as we have experienced recently. There's also the workforce is using it. So this is where I was listening to it from a different point of view. So when the clinicians brought up, we need to create a standard for AI, and they started talking about diagnoses, I go, wait, time out. Let's go to the top of the organization. Is the board exposed today from AI's use and decisions inside your health system?
Use or misuse?
Absolutely. And my point of view, if I'm sitting as a board member or I'm the CEO, this is what's keeping me up at night right now, because I have no clue how invasive AI is in my system. I don't have guardrails on what I call responsible implementation. So I brought that up, and then the first committees, as we were in our early discussions, we agreed we need governance. AI is in need of governance right now. It's the Wild West. We need to put some city limits on this one way or another and create law and order. That's all we really need to do right now with AI. So I teach in various places, and you know that, and always ask my audience, how many of you use AI right now in your daily work or in your lives? They raise their hand. About 40% of the class raise their hands. And I'm talking mid to senior healthcare professionals. How many of you have disclosed you use it to your bosses? Most all the hands go down. How many of you have been trained on it? Nobody raises their hand. How many of you have been trained on ethical and responsible use? Nobody raises their hands. How many of you feel a need to be transparent with its use? About 5 raise their hands. It tells me that it started. It started because I believe that AI is a necessary and important part of the future of healthcare. I believe it's necessary for lots of reasons, but having some rules by which it's implemented in the health system is essential. And so we decided then to pivot into creating a structure and a standard for AI governance. That's really what we started to do, and that was the original discussion.
And what parts of the U.S. healthcare system then will your standard apply to? The whole thing?
The whole thing. We not only to the healthcare delivery, we believe it needs to apply to vendors, to product manufacturers, to payers, pharma, and ancillary, such as in labs. We believe the entire system, and by the way, potentially for home health, hospital at home operations. I mean, everything in healthcare right now needs to have some accountability to AI's implementation and its use.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So where is the board, your group? Where are you in actually drafting the standard? How far along are you? Do you have an outline? What's the structure? That sort of thing.
So we have developed we posted our pin, as I said, in July. The early on was the project implementation guideline. So we developed the structure of our scope 9 points in July. It was posted through September. At September, comment period closed. We were granted permission by ANSI to proceed with developing an AI governance standard for healthcare. So we have started. The co-chairs of the committee have met. They're both physicians, as we wanted them to be. And we are now sorting out the committee across the 9 sub-elements and creating subcommittees to oversee development of those AI governance rules within those 9 content areas.
And what are those 9?
Well, there's the ethical and the privacy framework. Are we in fact using AI responsibly, ethically, and transparently when we're working with our patients? And are we, by the way, protecting privacy appropriately as we use patient data as the database of our AI development, our AI bots? It's really just protecting the interest of physicians and other administrative staff who also use it. So we're trying to find the balance between the ethics of this and transparency and disclosure. The other is just regulatory compliance. Are the AIs assuring that we're in compliance with regulatory guidelines and other, such as HIPAA, such as other elements that we need to do? And it also has to do with U.S., and then we're going to also look at international regulations and guidelines for how AI can be introduced into healthcare. Here's a point that's a little bit important that I think we need to address is that I believe that AI has now made knowledge equivalent to cash, that it now must be managed as another resource inside the organization. Knowledge can be acquired, knowledge can be developed, knowledge can be shared and spent. Therefore, I believe this standard in this governance structure can't be overseen by the CIO or CMIO. It must be direct report to the CEO or the board of directors. It is equivalent to the resource of cash or my buildings. Knowledge now has been elevated. And knowledge, by the way, isn't just what my people know, because in the very near future, everybody will know everything.
So your view would be that the director of AI for a company, if you will, that title, would report directly to the board.
The standard's going to be the CEO or the board of directors, because they both have equivalent risk, accountability, and responsibility for appropriate AI implementation.
Yeah, kind of like an internal audit director would today. I mean, his or her boss might be the CEO, but they have a direct line to the board.
So, for instance, when you develop, there will be an AI standing committee just required, like the physicians, like the executive committee that's required of every organization by the Joint Commission. There'll be an AI required AI committee. But every other committee in the organization must have an AI piece to it as well. There must be a direct reportable element of AI in every other committee in the organization. Because remember, AI is not just being used by clinicians, it's being used by everybody. And by the way, AI is present in a lot of medical products today that we use. We don't even realize it's there. That's why we need vendors to also fully disclose AI elements of the products. That's where the FDA may come in as they're looking at AI in medical devices. So we will go through and look at not only data governance, where's the data sources, and can we track the data sources of the AI bots we're using in the organization, and how do we govern that data? Is our current data validation processes today appropriate for AI and its rapid use? Don't know. Not so sure they are. We have a problem with data today. The other is, what if you decide to develop your own internal AI? We will be there shortly because AI will write itself. Well, who's responsible for that, and how are you disclosing that? What's your process for internal AI development and validation? How are you going to implement this? How's it done? What are the guidelines? Are you tracking? Is the process trackable and auditable throughout that process? Monitoring and evaluation of its use. What if you have a problem? And then we get into risk management. What about bad outcomes? You have to have auditable sentinel events. You have to have root cause analysis for all AI events, which may fall outside of traditional Joint Commission or other oversight entities. Because the whole point is, when you use it, how are you disclosing you're using it? And by the way, are you responsibly using it in your organization? Do you have the appropriate, what I call check engine lights for it when it's used? What's your communication plan for its use with your patients as well as your staff? Transparency completely. Are you getting the appropriate disclosures, legal disclosures with patients when AI is used in their care? And then how do you share this with the public in a positive way and show that the AI is in fact helping you improve care, not just improving your margin, which in the early stages we've seen it has been used to reduce staffing, to reduce cost, to maybe target enhanced revenue. We're just in the infancy of it being used safely for clinical decision making and physician knowledge augmentation, and frankly, or just other clinical decision making or communication with patients. It's just in the infancy there. But we believe we need to get the standard ahead of the proliferation of vendors who are already showing up, by the way, with AI, let me just say, bots, boxes, devices that promise the world, and you have no idea where the data is coming from. We want vendors to fully disclose sources of data, ethical considerations, everything we've asked in the standard for governance. We want vendors to have to be able to prove that as well. And then the last one is just, do you have a continuous improvement process for AI? How are you building that so that AI learns about itself? It learns rapidly. And I think we have to have oversight of that within your organization. So we see this, it's a pretty complex process, but I envision it as being very tightly woven within itself so that AI, as I said, is managed like cash. Everybody will touch it. Everybody will need it. Everybody will use it. But everything must be transparent and fully accountable. So in summary, the 9 points we're talking about are the ethical and privacy framework, regulatory compliance, data governance, AI development processes, implementation guidelines, monitoring and evaluation of AI, risk management, transparent communications, and continuous improvement. And then I would add that under the development and the implementation, we have massive amounts of training. We didn't believe training should stand alone as a 10th, but we do. Training should be a very foundational element of these standards as well. That people are taught, here's the bot here's the AI product we will use, here's the restraints on its use, and we're going to train you to ethically use it to augment your own knowledge. And then, and that's an important part that we can talk about in a minute about how it can be used as individuals.
Yeah, I mean, just shooting from the hip here, listening to you, it sounds to me like training and development should have its own silo here. I mean, if people aren't properly trained on the use of AI, then all the other pillars of your 9 points, they could start to fall apart.
Right. And we're in development of that now as we're vetting these 9, and we're building, frankly, national experts and recruiting national experts in each of those focus areas to build the standard.
So it sounds like a pretty heavy lift from your end. How long do you expect it to take you to get that standard drafted and then finalized through the ANSI process and then finally approved? What's your goal for timeline?
We would love to see it done within 12 months, but realistically, I think we're looking at 18 by the time we get the comment period. Because, and I say that because even though we didn't get a comment, we didn't get any comments, frankly, in that period that we posted. We were shocked at that. I just think we're so early and so below the radar, nobody sees the potential for this. Once we develop it and the word gets out, because we're already beginning to have a communication plan to speak to this in conferences, because we already kind of have that space carved out to develop this standard. Now we're going to start socializing it through conferences and speeches. Once we do that to recruit people or experts to come in across industry, because what we would love to have in the end is not only have functional experts on these roles, but also have health systems and have AI developers involved in this as well. We think that would help give us credibility at the end of the standard. And by the way, if you're involved in the standard, you are named as a standard development individual as well when it's finally published. That gives you credibility, gives you a lot of just a gravitas to speak to this in some way.
So as you're developing the standard over the next 12 to 18 months, AI being what it is going to be moving along with you. So it's you're kind of chasing a goalpost that's moving in front of you.
Yeah.
So what's the continuing or ongoing role of your development board going to be? Are you going to be continually updating the policy, that sort of thing?
Well, we're trying to keep it at such a high level, no matter the noise that happens right now, it will all be applicable. We're trying to keep it at such a high level of governance that no matter the products and the rapid pace of AI, once the standard's published, okay, the rules, the sheriff arrived, so to speak. And you have to then say, are we at a point where we can begin to adapt to the standard over time? Because our fear is that if it's left unchecked, it will be dangerous. A great example, and I just dealt with this recently with a physician out of our program who was writing a paper. She's a radiologist. And all of a sudden, AI is reading low acuity images for her. So her workload has changed. Well, the organization is saying, I've got AI reading all of these lower acuity images. I need to fill your time with more high acuity images, but I also want to cut your pay because you're doing less work. And my challenge to her was, who signs the images that AI reads? It's your credentials on the line. You're still signing for those. So you need to change a comp model, not from time, but to risk. I'm being paid for my risk. And so all of a sudden, the efficiencies that systems are looking for with physicians may not be there. If you have AI documenting an encounter where in the past you would handwrite 3/4 of a page, well, AI gives you 6 pages now to document an encounter. You need to read 6 pages to sign it because it can provide so much information, your risk is enhanced. But there's this balance between AI trying to document for reimbursement everything that happens, but that documentation also becomes risk because you now have exposure on so much being documented. And how does compensation work in that? These are things we haven't addressed that's already appearing. We want this standard of governance to help oversee that and frankly make it transparent and have the physicians step up with a voice in the development of this process.
Yeah, like I said, it sounds like a heavy lift to me because you've got to balance making the standard evergreen, so that it will continue to evolve.
Yes.
You don't have to keep changing it as machine learning or whatever we have today is moving on to the next phase, and yet not have it be so deep, so long and voluminous that no one can follow it. There's just a lot of things to consider.
But so we do have to maintain the standard over time. There is maintenance required for this. So the standard there will be adjustments and addendums to this as we track its use. But take it to the other extreme and look at what we're trying to improve. We're trying to assure safe, ethical healthcare at an affordable cost. That's what we're trying to protect. And if you create a governance structure that protects us from this cultural shift of AI dependency, you just have to say, here's where it can be used and where it can't be used. See, in here right now, there's no off limits for AI today in healthcare. We don't even know where it's being used, just in our workforce. Do we even know that everybody today has created content they're delivering to you? Do they even know what this thing says, this document says, if Claude or ChatGPT created it? So I think, as I said earlier, we're coming to a point of time where we're not sure where knowledge really sits. I had this discussion with my physicians. Now I'm going a little further. I'm going to go really out on a limb, talk about med school. I had a discussion just this weekend with the docs, and I said, I envision a day in the very near future where a physician will not be selected to med school by people. It will be selected by AI, and your MCAT scores are useless. You will meet a threshold of the ability to manage knowledge, but you won't have to know things. You won't have to even have the ability to retain knowledge. Knowledge will be of no use any longer because everybody will have knowledge. It's how you connect to that knowledge and how you relate to patients that will make you different. So in the future, physicians will be maybe hard on empathy, compassion, and caring, and their ability to connect to humans, and except for two that have the unique skills that are required, what I call hand skills, that are required. And even that in time will be replaced by robotics. But the point is, you will have AI selecting you for school. When you start med school, you'll be issued a bot, and the bot will not be there to pick up medical knowledge. The bot will already have all the medical knowledge known as of 3 minutes ago. The bot will be there to learn you and learn your mannerisms, your values, your communication skills. It will work with you to make you a better physician that cares with compassion. It will follow you through med school. It'll follow you through your specialty, and it'll follow you in the exam room when you start work. It will know the patients. It will know all of your patients. It'll also know you and know all the knowledge. So therefore, where will physicians be when that happens? And my whole point is, do we have a governance process to manage that as it happens? There's nothing to stop that from happening today. And that's our point of governance.
Well, it will be interesting to see what happens with this as you progress in the next, like you said, 12 to 18 months. And so we'll probably ask to check in with you at some point to find out how things are going. But thank you so much for being with us today and taking us through the state of the standard setting process in AI, which I think everyone knew was coming. And it's just good to know that there's somebody actually behind the wheel.
Well, thank you. I do say I lay awake a little bit at night worried about this. Again, if I were back in a CEO role today, this would be my number one priority right now in my own institution, in my health system. I would have this governance team already. I would have it already structured. It keeps me awake knowing AI is making decisions about my organization and is disguising the potential of my team. That's the scary part.
Well, good luck in the standard setting process, and we'll look at.
Thank you.
We will look in on you in the future.
I appreciate that. Thanks for doing this. It's a great way to share information and share knowledge. I appreciate you doing this. Thank you.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management and the healthcare management business degrees and certificates available to seasoned clinicians, master's students, and undergrads through the University of Texas at Dallas, go to jindal.utdallas.edu healthcare.